We have 34 new test positive cases here in British Columbia, bringing our total to 1,370. That includes 626 people in Vancouver Coastal Health, 508 in Fraser Health Authority, 82 on Vancouver Island Health Authority, 130 in Interior Health, and 24 in the Northern Health Authority. Right now, in terms of our case status, we have 132 people who are in hospital around the province, and of those, 68 are in critical care or ICU. We have, unfortunately, 2 more people who have succumbed to COVID-19, bringing the total number of people who have died to 50 in British Columbia, and that is 1 person in Vancouver Coastal and 1 in Fraser Health in the past 24 hours. 858 people have fully recovered from COVID-19. I do want to talk for a few minutes about long-term care. We have no new facility outbreaks, and indeed we have an additional long-term care facility where the outbreak has been declared over. That's really good news. The 20 remaining facilities, however, continue to have active cases, and we have 235 in total cases that are associated with long-term care and assisted living, including 143 residents and 92 staff. And as you know, the vast majority of the people who have died are seniors and residents of long-term care. We recognize that residents of long-term care really and assisted living are very vulnerable to COVID-19, and the most important area that we do and what we are trying to do is make sure that the workers who provide the care and the service to people in long-term care are able to work at a single facility. This is something that we have recognized in public health from the very beginning of this outbreak, and indeed recognized it from outbreaks that we have every year, whether it's influenza or gastrointestinal outbreaks or even antimicrobial resistance outbreaks. The challenge that we have with care providers needing, and healthcare workers of all kinds needing to work at multiple different facilities makes it such a challenge to try and control outbreaks, and that has been brought to the forefront during this pandemic in many ways, and it is a part of the tragedy that we're dealing with the multiple long-term care facility outbreaks. And we have mentioned before, but as of today it's official, we have been using orders under both the Public Health Act that I've given and under the Emergency Programs Act to implement a process to make it possible for care workers, healthcare workers of all kinds to work at a single site only, and to be able to do that in a way that's effective and able to give support to staff who are continuing to respond courageously to the monumental challenges that we're facing, and to do their very best and the very best we can do to protect our elders and seniors in long-term care and assisted living. And they have our tremendous respect and support during this pandemic. This is, as we have said all along, we are taking a cross-government, all province, and every single one of us in this province are responding to try and stop COVID-19 from affecting our communities and our families. And this involves ensuring our healthcare system is robust and ready, and we've done many things around that. This is another step in long-term care that we know will make a difference. Taking care of our frontline healthcare workers so they can care for us is another important piece. Protecting and providing support to our most vulnerable, whether it's people with disabilities, people who are living on the streets, people who are in long-term care, our older citizens, our seniors and elders, people in remote communities and in other facilities. Doing all we can as individuals across this province to keep our firewall strong. And I do want to recognize that so many people across BC are doing their part, and it is making a difference. The single site order that we just talked about makes our health system stronger and is, in my mind, vital to preventing further transmission and protecting our elders and seniors. I also want to recognize the early childhood educators, the K-12 teachers, and the educational assistants who have really stepped up around the province and are in classrooms and daycares to support our healthcare workers and other essential workers, but particularly to support our healthcare workers and our most vulnerable children, the children who are most at risk of falling behind because of this pandemic. So thank you to them. Those kids would otherwise face setbacks that they may have difficult challenges for the rest of their lives, and the work that you're doing is incredibly important, so thank you for that. As I've been saying all week, we are not over the hump yet, and we are going to have a bumpy ride for a while. We're holding our own, and we're keeping it down, but we all need to continue to do this. And when we're going into this long weekend, it's more important than ever that we keep going, that everything we are doing now, we keep up. And I know this is a challenging time for many of us, both physically, emotionally, mentally, and it's hard, especially when those connections that we so need, those meaningful connections, are mostly virtual connections. And that is something that many of us have a hard time getting used to. There are many resources that we're making available more and more to you, and as announced today by Minister Judy Darcy, more is on the way. If you are struggling and you need extra help, please reach out. We talked earlier this week about there's a number of websites. You can reach out to your primary care physicians. You can go to Anxiety Canada, Bounce Back BC, and there is more resources that were announced just this morning by Minister Darcy. So this is a long weekend for many. It's a weekend as well when there's many religious and faith-based things going on. And what I really want to say is, let's make this a weekend to unwind, but to be kind. It's a weekend for us to stay at home and to appreciate what we have. Now is not the time for travel unless it's absolutely necessary and you need to take care of your family. There's lots that we can do close to home, with our family, with the people we live with our close circle of friends. Have fun, but be safe. Reach out to your elderly neighbor, offer to tidy their garden, drop off food, host your own cooking show online, stream a movie with a friend. There are so many things that we are starting to do now to stay connected. We can have a virtual block party at 7 o'clock. I know in my neighborhood we do that. Sit in the sun and read a book. It's supposed to be nice this weekend, but stay close. It's also okay to go for a bike ride or go for a walk in the sun, but keep your distance. Let's wave hello to our friends and neighbors, wave hello to those that we pass, but from a safe distance. We all need kindness, and we all need connection. So let's do that safely and do that at home this weekend, and to continue the mantra to be kind and to be calm and to be safe.